Hi everyone, it's the Fly for Doctor. Welcome to this week's episode. Today we're going to be talking about neuropathy, what causes it, what are the symptoms, what can you do at home, and maybe some things that you can do to avoid it. If you're new to this channel, welcome. It's the Fly for Doctor. I'm a foot and ankle surgeon and podiatrist out here in Houston, Texas. If you want to see me specifically, you can follow the link down below to book our appointment on our website or give us a call and we'll book an appointment with you. Meanwhile, let's get into this video right now. For starters, what is neuropathy? Neuropathy is the damage to the peripheral nerves of the body. But before we get into that, let's break it down a little bit further. Let's get to the genesis of it so we can understand it better. Now, the nervous system is made out of two systems. The central nervous system, which consists of the brain and the spinal cord, and the peripheral system, which are the branches. They're going out of the station. Going out from central station, they're going out to the rest of the body. They transmit and transfer information from the brain to the rest of the body. And when the rest of the body has information to send back to the brain, like, oh, don't step on that, it's hot, you need to move your foot, those peripheral nerves transfer that message and signal like heat, nope, doesn't sound good, to the brain, and the brain sends a message back like, oh, heat, we need to get our foot off of there or take our hands off of the burner and things like that. So those are the two systems. So when you have peripheral neuropathy, essentially it's damage to the nerves of the peripheral nervous system. Now, the peripheral nervous system consists of two subsets. So now we're talking about the sensory nerves as well as the motor nerves. The sensory nerves is what helps us feel, is what helps us know, okay, this feels rough, this feels smooth, this is hot, this is cold, this is warm, this is winter, this is summer, all of that. It makes us sense things, right? Now, motor helps us move. So you can think of it like a car, I think. So think of it like a car. I like to use analogies. It works for me. It makes me remember stuff easily. So if that helps you, hey, use it, okay? So motor system helps us move. It tells our muscles what to do. So certain nerves are just motor nerves. They tell the muscles, hey, move this way, contract. And when, like our quads, if they contract, they move our knees a certain way. While some other nerves, they can send a message, but all their messages to just feel things, okay? So there could be damage to the sensory nerves or the motor nerves, or one or the other, or even both of them. So I feel like that's good enough background before we get into what could be happening, causes, and all of that, yada, yada, yada. Now, neuropathy would typically cause weakness, numbness, and pain to our hands or our feet, or the most, again, peripheral parts of our body. So, like, if you think about it, I said numbness, which is kind of like the sensory part of it. Pain comes in the form of burning sensation, tingling sensation, pins and needles. Sometimes some patients feel like fire ants are walking on their feet or their legs or their ankles or their hands. And weaknesses, patients feel unstable. They feel like they're falling a lot. They feel like they just can't balance when they walk because sometimes the motor nerves, like we've said earlier, are affected. Now, this is potentially a problem, especially if you have things like diabetes or you're pretty sick, okay? So this is where we start to have concerns and we're worried, and we want to make sure that we identify and take care of it as soon as possible. Now, what are the causes of peripheral neuropathy? According to the American Diabetes Association, about 60 to 70% of patients who have diabetes will develop peripheral neuropathy in the United States. So that's to say that diabetes is the #1 cause of peripheral neuropathy in the US. Now, there are other causes like medication, alcoholism, some sort of disease, some sort of surgery that may have removed certain parts of our intestines and things like that, chemotherapy, accidents that may have caused damage to the nerves, or some sort of chronic damage to the nerves that have resulted in them being diseased. All of these are also causes of neuropathy. So we have an idea of what causes it, but what does that feel like? What does peripheral neuropathy feel like? Well, one of the most common sensations is numbness. Patients would just say, I can't feel, like I know it's there, I know there's water on my foot, but I can't feel it. If you've ever been stuck on a toilet seat reading that Instagram post or for hours on TikTok or on YouTube on here, and you go to stand up and you fall over, or you're weak, or you feel that pins and needles, or, ooh, one of this is a good one. If you've ever hit your elbow and it hits right there, that ulnar nerve, and you feel that sharp shooting sensation that goes up to your fifth and fourth fingers. I know I felt it before, so let me know down in the comments if that's happened to you and what you did about it. So that sensation where it's like it's numb, or it's a sharp shooting pain, or it is tingling and it's just like electric shock, that is one of the #1 symptom of neuropathy. Others are just like fire ants or burning. Once you start to hear, I feel like something's burning, I feel like it's a blow torch, or it just kind of hurts, that is usually a symptom of neuropathy as well. Some patients may feel weakness in their foot. They just feel weak, and it's usually limited, maybe to how they walk, or they feel unstable, or they feel like they're losing their balance. Those may be signs and symptoms of peripheral neuropathy. If you feel like you're inspecting your foot and you can't tell when you're having an ulcer, and all of a sudden you're like, I have this wound, or you stepped on a nail, or you noticed you stepped on something, or there was a pebble in your shoe or something like that, and you didn't know about it because, well, I guess you didn't feel it. Honey, that could be a sign of neuropathy. See a doctor as soon as possible. There are tests that can be done to find out if you do have neuropathy that is done in the doctor's office. If you have a wound that's not healing appropriately and it's just kind of hanging out there and it's at the bottom of your foot and you keep walking on it, that's another sign. Well, if you have peripheral neuropathy, what can you do about it? Most of what I'm gonna tell you is just management. And again, this is just my personal opinion that I am sharing. Please check with your doctor before you do any of these things. Verify and get a clearance from them that they are okay with you doing it. I don't want to get in hot boiling water with any of y'all because you guys went and did something that I told you without checking with your doctor. So please, please, please check with your doctor. As far as pain, you can use some over-the-counter medication as long as it's cleared by your doctor. That just kind of helps to manage discomfort. There are other medicines that are nerve specific, but they are prescription strength. So follow up with your doctor so they can see if this is a medicine that they can prescribe for you. If you want to see me specifically, like I said, you can look at the description down below, and we'll have our phone number and our website where you can call or visit to book an appointment. Also, having regular exercise is a good idea, but make sure that while you're exercising, you're inspecting your foot and wearing appropriate shoes. You don't want to wear any shoe that could cause additional friction or cause a wound or a blister or a callus that could cause more problems. But regular exercise is of great advantage. It'll help you to just help reduce your blood sugar and help you manage all of the diseases that you got going on. And speaking of reduce your blood sugar, reducing your blood sugar or keeping it under control, keeping your A1C under control is absolutely important. If you or a family member or anyone you know have diabetes, ask them what is their A1C. Their A1C is a 3-month measurement of their blood glucose to tell how we've been managing it, okay? So you wanna make sure that you're checking that and that we wanna keep that at least under 7. Anything over 7 means it is a poorly managed diabetic patient and we don't want that. So make sure that you are checking that every 3 months whenever you go to visit your doctor. Of course, if you have neuropathy, you can't really feel, and there may be breakdown in your foot, and we will talk about that in our next video when we talk about sarconeuroarthropathy. So you want to make sure that you can try to get custom orthotics that cushion the bottom of your foot and prevent any prominences from causing or rubbing on your foot. So make sure that you are checking on that and check with your foot doctor or podiatrist if they can create custom orthotics for you. Also, sometimes a TENS unit may work, and it's a transcutaneous electric nerve stimulator device that helps to kind of stimulate the nerves to work appropriately. That is definitely something that you can try out. If you're interested, ask your doctor again. They may be able to prescribe that for you. Now, if you've been diagnosed with neuropathy, what can you do? Well, number one, you want to make sure that you're inspecting your foot every day. You do it yourself. If you can't do it yourself, maybe you can't raise your foot to look at it or bend over, have somebody do it every single day. You want to look at the bottom of your foot, the top of your foot, the sides, and between your toes. You want to look in your shoes, make sure that there are no pebbles, rocks, nails, or anything like that could cause issues. Also, make sure that you are wearing fitted shoes. They're fitted appropriately. Visit your podiatrist or your foot doctor around your area. Let them advise you on the kind of shoes to wear that could avoid friction and avoid callus formation or even ulcer development. Also, make sure that you are taking it easy and exercising as often, as frequently, and as safely as possible. Most importantly, do not walk around barefoot, okay? If you have neuropathy, you can't feel. You can get bit by a snake and not even know it. And by the time you come to the doctor, it's already really, 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 really bad. So that is quite extreme of an example, but you get the point. Make sure you don't walk barefoot. You always have something that's supporting your foot. And also, if you're diabetic, make sure that you keep your blood sugar under control. It'll ultimately help you to get in control of the rest of the stuff that's going on. Thank you for sticking with me till the end. It's the Fly for Doctor. Did you enjoy this video? And which one of these things that I talked about will you or a family member, neighbor, friend, or someone that you know, will you be advising them to do? I'd like to know. Leave it down below. Also, what questions do you have? Leave them down below. I'll be able to answer it to the best of my abilities as much as I can over the internet. If you want to see me specifically, visit our website, which is linked down below, or give us a call down below. To follow me on my other social media platforms, we have Instagram as well as TikTok. It's the same name, The Fly for Doctor. Thank you so much for sticking with me. Please share this video with your friends, family. I think it'd be greatly beneficial to them for them to learn these things and also apply it into their day-to-day lives. It also helps the YouTube algorithm pass this along to many more people so we can help as many patients as possible. Also, if you really like this video, would you consider liking it and sharing it, or even, commenting down below? I would really appreciate it. All right, till next time, it's a Fly for Doctor. Take care. Peace out.